Respected seniors and my dear colleagues, greetings on World Asthma Day. I am Dr. Sushant Mane, Associate Professor and in charge of the Pediatric Asthma Clinic at the Grand Government Medical College, Sir JJ Group of Hospitals, Mumbai. We all know asthma is the most common chronic non-communicable disease which affects 260 million people across the globe. It causes around 4.5 lakh deaths globally. And what we must know is around 50% of these patients are children. We all have been diagnosing and treating asthma very well all these years. But more than the mortality, what it causes is the poor quality of life of our little kids. We all know and agree to the fact that inhalation therapy is the best therapy for asthma. But today, what we will see in addition to inhalation therapy is the modes by which we can give these inhalational medications to our kids. So like we say, not all size fits everyone or not one size fits everyone. Therefore, in inhalation therapy also, depending upon the ages, we have different devices. As we know, the inhaler is the most appropriate device for treatment of pediatric asthma. But do we give this inhaler alone? No. We always couple it with a spacer. There are many advantages of a spacer. Namely, the child does not have to coordinate his breaths. It acts as a holding chamber and therefore the child can breathe normally in his tidal breathing. It does not require too much of coordination. The medication does not directly hit the pharynx and therefore does not cause cough while taking. And because it causes less oropharyngeal deposition, side effects or oropharyngeal side effects like oral candidiasis or hoarseness of voice are also less. So always at any age, an inhaler has to be coupled with a spacer. However, in that also, depending upon how smaller or bigger is the child, we may couple the spacer along with a mask. So in children up to the age of 4 years, we use the inhaler along with a spacer and a mask attached to the mouthpiece of the spacer. However, 4 years and above, children are able to use the inhaler along with the spacer without the mask. Going ahead, we all know that there is a device known as a rotahaler. Do we really use rotahaler in practice? Not so much. Rotahalers are basically a type of inhalational device which we are using for patients or children who are 10 to 12 years and above, so we can say in adolescent category. It has advantages and disadvantages. The advantages being it's a very small pocket device, so people who are still under the stigma of taking medications can carry it without other people knowing it. However, it requires a very forceful maneuver to take the medication inside and has a lot of oropharyngeal deposition. And therefore, it is not the first preference when we talk about inhalation therapy. The first preference is always an inhaler with a spacer at all ages. Now, there is a good news for all those of us who are not comfortable using a spacer. You know, children, especially adolescents, as they grow up, they are not very much comfortable with the idea first of using an inhaler and on the top of it, coupling it up with a spacer. And therefore today we have a breath actuated inhaler. It is like magic. What does it do? It takes away the spacer from the inhalational therapy. This breath actuated device is made in such a way that it will get actuated only with the breath of the child when the child puts it in the mouth and takes a long and deep inspiration. It will not get activated unless and until the child takes a long and deep inspiration, and the child can have a normal breathing after that. What we must remember while using a breath actuated inhaler is take a forceful breath in, ask the child to hold the breath for a few seconds, approximately 6 to 10 seconds, and then expire through the nose. This is the way how you use a breath actuated inhaler. Like we saw that it requires some amount of respiratory coordination. Again, a child 8 to 10 years and above is comfortable using a breath actuated inhaler. The only disadvantage of a BAI, what we can say is again, the drugs directly go into the oral cavity and your respiratory tract. So the chances of side effects are a little more if the child does not rinse the mouth. That brings us to the most important post-inhalational effect, that is, after any inhalation therapy, the child has to be instructed to wash the tongue and the mouth properly. Friends, this World Asthma Day, the theme is Asthma Education Empowers. education starts with self. So let us all, as pediatricians and caregivers to our little kids, learn the proper technique of inhalation so that we can help our children with asthma breathe free. Thank you.